And I think the earlier you can tie your impact to quantifiable results that matter for the business and surface those, it's going to do two things. One, it's going to help you elevate yourself in the eyes of your manager, maybe in your manager to the leadership team, whatever that looks like. It helps that story be like no brainer. But it also helps you build the habit of everything that you do if it comes to prioritization or if it comes to outlining a quarterly plan or a yearly strategy. It helps you better build that habit of what are the results that I want to return? How will I measure success against that? And coming back to it month over month, week over week, quarter over quarter, whatever it is. And again, I think if you don't develop those skills early enough, it will be hard to be seen as an executive leader, to position yourself as an executive leader.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Caty Reid, who is a Chief Growth Officer at Probably Genetic. Caty, thank you so much for being here today, and welcome to the podcast.
Yeah, thanks for having me. Excited to have the conversation.
I am as well, and I love to start off in the exact same way I start every single one of these conversations, which is just telling everyone a little bit more about yourself, a little bit more about the company, and any other context that you'd like to share. And something that I've started adding now is, tell me about the big problem you guys solve.
All right, that's a lot. Hopefully I don't take the entire time just doing that. I'll start with me. So my name is Caty. As you said, I have been in the biotech industry for the entirety of my career, which is about 15 years or so now. Mostly on the marketing and advertising side of things, although as I've gained momentum and moved through companies that started to include communications, it started to include operations and other pieces of it. As you probably well know, the earlier stage company I go to, the more things I seem to be doing, which is great. But what I will say, and we'll come back to it when we talk about Probably Genetic, it's just more and more functions of a business that touch the patient experience when we think about how to really transform either care or diagnostics for patients and you're starting from the marketing and communication side of bringing them in, it then becomes a lot more about their touch points with providers, their touch points with others in the organization. And so I think there's sort of a natural progression there that's happening for me in my career, but also patients as they get more active in their own career. I'll come back to that and talk about that in a second. Right now I'm at a company called Probably Genetic. It is at its core a health technology company focused on rare and complex genetic diseases. The quote I'll just quickly articulate is well over 70% of rare or complex conditions are genetic in nature. So they have some genetic component that is underlying or causing the disease or symptoms a patient is going through. So genetics play a huge role in these rare conditions. And the other thing to note, and it's another stat, but it's important, is one of the sort of continuously frustrating and perplexing things in the rare disease space is what we call the diagnostic odyssey. So how long it takes for these patients to get an accurate diagnosis. The average is somewhere between 5 to 7 years. So let's call it 6 years on average. But that means there are so many people who are also going 10, 15, 20 years without an accurate diagnosis for their symptoms.
Yeah.
Without an accurate diagnosis, you cannot have your symptoms properly managed. You cannot get treatment. And if you think about it from the biopharma standpoint and life sciences industry, if they're not getting diagnosed, that means that these patients can't participate in research, participate in clinical trial, can't get on drug, which sort of poses a huge problem on that side of things as well. So our company, Probably Genetic, essentially has set out to fix both of those problems, which are inherently the same problem, which is patient identification. So how do we use technology to identify more of these patients earlier so that from the patient journey standpoint, the patients are being identified earlier so they can, not go on, treatments that are wrong for them, get treatments that are right for them so that they get connected to communities that are going through the same thing, so they get options for clinical trial. I think it's not hard to imagine how the patient journey, gets better as they are accurately diagnosed. And then again, for life sciences, it actually allows them to research, develop, and commercialize products faster because, especially in rare disease, identification is a huge problem. And it's
Hmm.
sort of like it is a roadblock by which, if you cannot get over it, you cannot proceed in whatever sort of the next step is for that asset, for that therapy.
Hmm.
Uh,
And it
the
can be
way
like a negative snowball effect from there on as well, right? Because there's so much lack of clarity in this specific thing that it'll lead to many negative impacts on all these other subsequent things as well.
Yeah, and snowball sort of triggered for me. I think the vicious cycle that people don't necessarily think of is a lot of patients will say, why would I bother getting genetic testing? I'm pretty sure I have X, or I'm pretty sure I have X in this family, and there's no treatments available. So like, what would having that variant information do for me? But if
Uh,
we keep saying that endlessly and we keep just not identifying patients, we literally cannot then develop treatments. We cannot then personalize medicine the way that we need to for care. And so there is this like, we all need to sort of get on board with the fact that
mhm,
we need to understand patients' like underlying genetic makeup in the rare disease space to be able to progress everything so that that's not even a question anymore. It's, of
mhm.
course, I want to know whatever is going on with my DNA because I want the best possible treatment, and that starts with identification before anything else. It's, you can't like have therapy come first if we've never looked at this patient community or had enough to study it and develop against it accurately.
Yeah, well, no, thank you so much for clarifying all those things. And it's like the wrong sequence, right? It's like trying to bake a cake and then putting the eggs last. I'm like, I'm not sure how great that's gonna go, or putting the tray in the oven empty before actually mixing all the ingredients. Like, it's not gonna happen. So
That's
it's
right.
you're giving that clarity there. And I wanted to actually ask something that I believe we might have touched on in our first conversation, which is there's around, correct me if I'm wrong here, 400 million people in the world that have some sort of rare disease that are unaware of it, and go through this entire lack of clarity thing that we were just talking about it, and the consequences that can come from there. Is that correct?
Yeah, I'd say that's probably accurate. It depends what source you pull from and what diseases you're considering, but like hundreds of millions is
Yeah.
absolutely accurate.
Yeah, I believe I was actually looking. Maybe it might have been something in the company's LinkedIn or the website as well, and that number just astonished me. And I was like,
Yeah,
400 million is a lot of millions, lots of hundreds of millions, right? So it's not just
many
like this.
hundreds. Yeah.
Yeah, because I think whenever we hear the term rare, it's like, oh, it's really, really rare. But
Mhm.
rare, there's also 8 billion people in the world. And we forget that sometimes, right? 8 billion is a huge number that people can sometimes seem hard to quantify. It's like, how do you even think about that number? But translating that down a little bit lower, there's many people, even though it is rare, that still need that sort of help.
Yeah. 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 And the way we talk about it in the rare disease community or space is, individually, these conditions may make up in a super tiny, tiny subset of people, but all together, yeah, it's
Mhm.
hundreds of millions. And a lot of the issues that plague the individual subsets are common. It's not specific to one rare condition over another that genetic testing, there's a lot of access issues with genetic testing, or
Mhm.
that providers at a community level may not have information on that class of disease, or on that family of disease. Like, that's not particular to one, that is across the thousands and thousands and thousands of rare diseases there are. And so, like, I do also think that the way we as a population, the way as a nation, as a world, the way we think about these shouldn't be as just the individual condition that might only be affecting 50 people in the whole wide world. But if you actually take the commonalities that are
Mhm.
like plaguing, like, there's a lot to solve there that would, to your point,
Mhm.
impact hundreds of millions of people if we figured out a way that, communicated across the conditions,
Mhm.
which identifying patients early would, like,
Yeah.
having a way that sort of solves that problem would benefit all people, regardless of what they have there.
Yeah,
So
amazing. Yeah, no, thank you so much for sharing that. And I love to tie that into the company itself, and how
yeah.
you guys are actually partnering with other organizations to help that happen. So talk to me a little bit more about that dynamic when you are partnering with these larger organizations, maybe smaller organizations as well. How does that go down? How are you guys able to identify those things earlier to then ultimately help all these patients?
Yeah. So like there's a couple different ways to think about this. Ultimately, we are trying to build the largest data set in the rare disease space that would have patient data, hopefully at a variant level for all of these conditions that I'm talking about. So again, there's thousands and thousands of rare diseases. The pie in the sky, like where you want to be is, we've identified all of those patients, which is, pretty far reaching, but let's do it. We've
Mhm.
identified all of those patients. And so that when a drug developer or even when a patient advocacy organization goes to develop a body of research or goes
Mhm.
to, move to the next phase of their clinical trial, they could just come to us and say, we're looking to develop something for patients that have X variant, right? They're dealing with this mutation, which is this disorder. Do you know, I need 15 of them because I need to be able to like look at the variant information, study it, or we need you, probably genetic, to be able to reach out to them to let them
Mhm.
know we're enrolling in this trial and we're looking for 40. Probably genetic has all 40. Like that's what we're building. No, again,
Mhm.
this is like no matter what condition they have. And the biggest way that we're doing that is by using technology to make patient identification
Mhm.
more, much more possible and quick by removing a lot of the access barriers.
Mhm.
So there's a couple of ways we're looking at removing access barriers. The main one, and the one we're probably the most well known for at the moment, is we offer we we have built a machine learning platform that if patients and caregivers put their symptom information, their health information, any relevant diagnoses into the assessment, then we can, for many of them, we can offer free genetic testing because we are working with a drug developer or a researcher on that condition. And
Mhm.
so we can then offer free genetic testing and genetic counseling, and it's all remote. And so
Mhm.
inherently in what I just said, there's a bunch of sort of access things that are changed there. There's free, obviously, which takes away the financial burden component of all of this. All remote is also really important because geography becomes a huge blocker, especially if you're, as a caregiver, being told that you can't get genetic testing for your child because you need to see a specialist first, and maybe that specialist is 3 hours away, and
Mhm.
they will only see you in person. They're not seeing you online. And so all of a sudden, like maybe you would have been able to get a referral for a genetic test, get it ordered. Maybe you would have even been able to pay for it, but you couldn't even get there
Mhm.
because geography is an issue for
Yeah.
you.
And only 6
Uh,
months away.
right. And then the third access piece that helps with, and I touched on this a little bit before, is physicians with the right knowledge of different symptom profiles that could be indicative of a rare or complex genetic condition. There are sort of more known ones in the treating zeitgeist. I think it's a little bit better known now that pediatric epilepsy is often associated with a underlying genetic condition. So maybe a pediatrician in your community would be better suited to order testing,
Mhm.
or a pediatric neurologist that you would probably get ordered testing. But if you're dealing with like a condition that's the symptom profile isn't pediatric epilepsy and it doesn't look like, I don't know, cystic fibrosis, and it's just like something that we don't all know about as well, and providers don't know about as well, it is likely that ordering comprehensive testing is not being thought of yet. And so like because we can sort of take these symptom profiles directly from patients, use machine learning algorithms to assess likelihood for
Mhm.
a rare genetic condition, we can kind of remove that barrier too. The like beautiful, wonderful, crazy thing about machine learning is that it can draw on all of the published information available in the entire world in a matter of seconds
Yeah.
to assess whether something might be a rare condition. Most physicians can't do that. Like that's a
Yep.
tall order. Because none of these things look like each other. The symptom profiles are all very different. And so
Mhm.
that model is like sort of crossing all, boxes there for access. Another thing that we've just rolled out and we're working on is, okay, well, even if it's not free, we know that this like remote access to genetic counseling and access to providers that sort of know what they're looking at when it comes to rare conditions better, as well as sort of a like machine learning
Mhm.
um assessment of whether you may have a genetic condition. We want to do that for patients who may have insurance and be able to cover this, but just have not found that avenue yet.
Hmm.
Because one of the problems that we face today is the free testing programs. It's testing a small amount of people. If you're talking about 400 million, like we don't have free programs for all 400 million right now, and it
Yeah.
will be a while before we get there. And so, like, how do we help other patients faster, remove some of the barriers, even if it's not full-fledged cost? And that just looks like, hey, we have partners in the genetic counseling space that are deeply familiar with
Hmm.
rare conditions and whole exome sequencing or whole genome sequencing for rare conditions. We'll connect you to them through a Zoom, through a video call, from the comfort of your home. Geography gone again, provider knowledge, we've taken that off the
Hmm.
list too. And then let's see if we can get insurance to cover it from there, which
Hmm.
will be an option for many depending on their symptom profile. And then sort of that's your like even
Hmm.
building and expanding on the amount of patients we can maybe get closer to or hopefully genetic tested so that we're identifying those variants much earlier, much faster, with that whole circle that we talked about. So
Yeah.
those are a couple of different, like, using technology to enable access
Hmm.
to testing and to ultimately earlier identification. And then regardless of how we're bringing these patients into our platform and getting them tested, all of it builds on the database of knowledge around these variants and by the way, and the symptoms that patients are experiencing in relation to the variants, which is extremely rich research information.
Amazing. Yeah, it sounds like you guys take a lot of the toll on so that everything is so seamless for all the partners that you guys work with, and it could just create that I'll call it frictionless, that frictionless procedure and flow for all the patients coming through, but also the partners that guys are helping, which is pretty awesome. And actually, I'd love to understand a little bit more, just even looking at the growth sense. You, as being a chief growth officer, it can be difficult at times, I think, in business. And from an outsider looking in, everything seems like sunshines and rainbows and companies doing great, but us internally, we know that there are challenges along the way. So when it comes to the growth of the company, tell me, Caty, a little bit more about maybe some of the challenges that you guys face when it comes to finding new partners, trying to increase the number of people that you guys are helping to ultimately, of course, help more patients. But I think it goes back to the conversation we were having in our first chat is, hey, we need to have this cycle. We need to have more the company to grow so that we can help more patients. But we also need to help more patients for the company to grow as well. So tell me about some of the challenges there.
Yeah. So, and I'll just sort of reiterate from our first conversations, but so everyone can hear, our revenue comes from large patient advocacy organizations or biopharma organizations that are investing in identification in these disease areas. So, ultimately, this isn't like a direct to consumer business where like the patients are paying us anything. They're not. We're getting it from those researching these conditions and looking to find patients. So when I talk about growth as a business, it's actually, other than finding the patients themselves, it's very much predicated on that.
Uh-huh.
So so that means I'm gonna hit this primarily from the life science
Yes.
angle. So one issue is technically what we're doing, that, like, if I was going to completely dumb down and take away all the innovation in what we're doing, technically what we're doing is something called sponsored testing programs. Sponsored testing programs have been around forever. I shouldn't say forever, but they're pretty standard in the industry
Hmm.
at this point. Traditional sponsored testing programs are going through the physician, and then the physician is going direct to a reference laboratory. It's not going direct to patients. So that's part of where we like flip this on its head. The reason
Hmm.
I'm bringing this up now is one of the things that we definitely run into is partners who have an existing sponsored testing program, which is the norm in the industry, right? To do it provider facing and through the lab. And
Hmm.
so we do run into a lot of like, yeah, but I'm already doing this today. And a huge lack of knowledge on
Hmm.
the sheer amount of patients that are being missed by going that route. There is so much data and proof on the fact that, like, many patients are not in their provider's office for all of the reasons that I listed. Many are, and you're going to get hopefully a good amount of them. I almost said handful, but that's how small these populations are.
Hmm.
By going that route, but when you're talking about a prevalence of, 1 in 5 million, if
Mhm.
you're only going to patients that are currently engaged in seeing a provider, you are very likely not going to find as many numbers as you need to in your
Mhm.
patient population. There is not like strong awareness of that there
Mm.
from these partners. There's awareness that like we have not reached our goal and we need to
Yeah.
identify more patients, but I think the disengagement with the system, that there are other ways to get to patients that are being missed by these methods.
Mhm.
I think that is like been one of our hurdles. And so,
Mhm.
you know, uh, very quickly, if I put on my, marketing hat in that setting, like it's taking the message from not convincing them to replace what they're doing today with our approach, but merging the two together so that like
Mhm.
you are not losing patients on what I would call either side. Like whether they
Mm.
are engaged in the healthcare system or they're not, hopefully you're going to find them and we're going to find them and help you either use the data or, get communications out to them.
Mhm.
But I think early on in pitches and in conversations, it's very much like I can do one or the other, and I'm already
Mm.
doing this, and it's traditional, and you're your own small company, and like
Nah.
anytime you're sort of innovating in a space, I think and doing something completely different, you're going to come up against that. Like
Nah.
you never want to, you probably know this, but like you never want your clients to think that you are a new line item in their budget that they must carve
Nah.
out.
Huh.
You
Uh-huh.
want to like work within line items ideally that they're doing today until you can sort of become your own. And so it's sort of that push pull with what we're doing with them.
Uh-huh.
Um, Another piece that will always be true in biopharma and life sciences is compliance.
Mhm.
So again, we're doing something that's basically somewhat never been done before, although there are anecdotes. And because of that, it's not a like compliance tried and tested methodology where everyone feels confident that the OIG is good and this goes to the letter of the law and we're not sort of going against any kickback statutes or anything like
Mhm.
that. And the other programs have been around for so long that like all, I's have been dotted and T's have been
Mhm.
crossed in that sense. And everybody's sort of running programs very similarly because of that. Because ours is new and
Mhm.
novel, it represents risk in that space. Some compliance teams are more willing to take on some risk in that area than
Mhm.
others. And so there's this whole other part of our business that, I don't think 2 years ago was maybe as apparent to us, which is like, how do we become compliantly bulletproof so
Mm.
that when we're having like our internal champions on the commercial team, on the medical affairs team, their game, they want in, they want to pay for this. How do we bulletproof the system so that when we get into that compliance conversation with their
Mm.
literal compliance and legal team, that it's like they've got this. It's a playbook.
Mm.
It's following the rules. We feel good. We're not taking on any risk. And
Yeah.
so that's something we're still developing now. Um, I you know, we have a ton of lawyers that would argue that what we're doing is very compliant and we are not sort of going against the grain in that sense.
Sure.
But until we have all of the sort of nuts and bolts to like look at that on paper and feel good about it, we will be like sort of inherently at risk in these
Mm.
conversations.
Mhm. Mhm.
Um,
Yeah.
and then the last one I'll say, and then I'll stop talking, is when you're signing partnerships early as a sort of new entity, a new thing, um, it can be very easy to get stuck in what we call pilot hell.
Mm.
And it happens to many, many companies. We are not unique in that regard. But like, okay, internal champion on commercial team loves this and wants to try it and see if it yields results in terms of um, identifying patients, but doesn't want to like go too far in and put their neck on the line for this,
Mhm.
this new company that a lot of people haven't worked with yet or whatever it is. And so it's like, let's do it for 6 months or a quarter. And among so many issues with that is that because these patient populations are so small, trying to sort of stand up the operations and have effective marketing and communications
Mhm.
all within 3 months for a population that affects 1 in 5 million or hell, 1 in 300,000 even. That can be really challenging. You
Mm.
sort of, like all businesses, you need time to get the engine humming.
Sure.
to like really start to see the results that you want. And, you know, a quarter doesn't usually do that. And so that's another thing that we is like important for us to continue to get ahead of and have solutions for as a
Mhm.
business, so that we can bring clients on and have them feel comfortable, but have enough time to do what we know we can do
Yeah.
for them.
Yeah. Interesting. Thank you for sharing all that and for going in depth as well. I think it's and correct me if I'm wrong here, but it almost sounds like they're all somewhat tied to being able to educate on the value that you guys are providing, but then also the ROI that they get from it and the how of your operations, as opposed to the usual way of always doing things, or the thing that we've done this way. We already have this on board. So really just having that way to educate and transfer that knowledge to the prospects and prospective clients, so that from the get-go they already understand it, and it's from there on it's going just upwards and onwards. Does that sound about right as well?
Yeah. And I think like, you know, to pat my company on the back, like more and more of our conversations now um are not why do I need this, and could this, you know, yield me data on patients that I'm looking for. The more we've grown, the more we have results that speak for themselves.
You're
We
perfect.
have
Yeah.
grown customer relationships that we can just point right back to with case studies and references. And like as we've gotten obviously more commercialized, like that part of the story has gotten better and better. And so if I were like that's still going to be a challenge, and we're going to work on it. But like, I actually think we have really great stories there and really great examples. Then we're now getting to the point of that, like that compliance stop point where it's like you get internal champions bought
Mhm.
in pretty quickly, that want to do it and see the results and see what, you know, what they might be able to get from it, from the relationship with us or from our platform.
Uh-huh.
And our like bigger whale is like getting to a level of comfortability with compliance that
Uh-huh.
like we could move faster into the contract and the start discussion. But as we go, the more we can tell stories, the more we have case studies of patients identified, what it ultimately meant in terms of outcomes for the organization we're working with. Again, whether that's recruitment, whether that's communications, whether that's, on drug, whatever it is,
Yeah.
the more of those we have, the easier that conversation becomes. And as long as the like compliance indicators are really clear, I do truly believe the sky's the limit, because this is an insanely important problem that everybody would be on board with being solved. And I think we've got a great solution. That like momentum snowball needs to keep being there.
Amazing. Good stuff. Katie, I have one final question for you here, and then I'll be out of here. And this question is actually not a question from me. It's a question from our last guest to you, and they had absolutely no idea who you were. So here's the question. You ready for it? All right. Here it is. If you were offering a word of advice to the audience who might be younger in their career about aspirations in executive leadership, what's one piece of advice you'd give them to navigate their early days?
We love surprise questions. Um, Anchor everything you can to results. And by results, I mean results that are measurable and quantifiable. I think a mistake that people earlier on in their career, including me, can and have made for decades, is the sort of like laundry list of things that you accomplish in a hopes of like elevating yourself or like moving to the next level. Like if you're constantly advocating for yourself, but you're just saying like, I launched a website, I helped publish a paper, I co-authored a paper, I sold these 4 clients. Like none of that is actually grounded in metrics, and in particular metrics for the business that matter. And I think the earlier you can tie your impact to quantifiable results that matter for the business and surface those, it's going to do 2 things. One, it's going to help you elevate yourself in the eyes of your manager, maybe in your manager to the leadership team, whatever that looks like. It helps that story be like no brainer.
Mhm.
But it also helps you build the habit of everything that you do if it comes to prioritization or if it comes to outlining a quarterly plan or a yearly strategy. It helps you better build that habit of what are the results that I want to return? How will I measure success against that? And coming back to it month over month, week over week, quarter over quarter, whatever it is. And
Mhm.
again, I think if you don't develop those skills early enough, it will be hard to be seen as an executive leader, to position yourself as an executive leader. And so, yeah, that's my advice.
I really like that because people don't care about experiences, they care about results, right? So
Yeah,
it's very
yeah.
amazing. Katy, thank you so much for your time. This has been such an incredible conversation. Where should people go if they want to learn a little bit more about you and, of course, also a little bit more about the company?
If they want to learn about me, my LinkedIn profile is probably the best place. I think it's just Caty-Reid, Reid, on LinkedIn. I do a fair bit of like professional posts there, but every once in a while I'll like blend it nicely with personal and some humor just to, I don't know, keep people entertained.
Yeah.
Um, and then probably genetic.com is our website. We're pretty active on socials. I'd point you to Instagram at probably genetic as a place to, just get to know more. And yeah,
Amazing. I will, of course, leave as many links down below here as I can. So if you
thank
want to
you.
check that out, please go click those. And if you're listening to this conversation, you enjoyed hearing this, and you want to hear more conversations like this, please also hit the subscribe button, and I will see you on the next episode. Katy, thanks again for your time.
Yeah, thank you.